Thank you for joining us today for this Medicare webinar series and today's topic, Medicare Part D, presented by the Pikes Peak Area Agency on Aging. We want to thank the Pikes Peak Library District for its support of this webinar series. Before we begin, we ask that you please keep your microphones muted until we reach the question and answer portions of the presentation. You can then unmute, use the raise hand function, or type your question into the chat area. And now it's my pleasure to introduce our presenter, Roma Costanza, State Health Insurance Program Coordinator and Case Manager at the Pikes Peak Area Agency on Aging. Roma, it's all yours. Roma, I think you're still muted.
Sorry about that. Thank you. All right. So good evening, everyone. Thank you for joining us tonight for our part 3 of our 4-part series of Medicare 101. And tonight we're going to focus on Medicare Part D, D for drug, the Medicare prescription benefit. Hopefully everybody received the email that I sent out earlier this afternoon that included the slides for tonight's presentation as well as a handout. As Jared mentioned, I will pause throughout the presentation to take questions. If you have a question, you are welcome to type that into the chat box at any time, and I will address them when I do pause. Or when I pause and ask for questions, you're welcome to simply unmute and ask your question at that time. So I think that's all the housekeeping, so let's go ahead and get started. If for some reason somebody did not receive the email that I sent out earlier, please feel free to type your information into the chat and we'll make sure that that gets sent to you this afternoon or tomorrow morning. All right, so Medicare 101 Part 3, Medicare Part D. As always, we're going to start with who I am with. I am with the Pikes Peak Area Agency on Aging, which is a part of the Pikes Peak Area Council of Governments. And the mission of the Pikes Peak Area Agency on Aging is to work with our partner communities of El Paso, Park, and Teller counties to create programs and develop systems that remove barriers to independent living within our region. This is also in partnership with the Pikes Peak Library District, and hopefully you found out about it through the library. I am the coordinator for the SHIP program here locally. We're located in Colorado Springs, but we serve a total of 9 counties. The SHIP program, which stands for State Health Insurance Program or Assistance Program, is a federally funded nationwide program that's designed to provide free and unbiased information and education on all things Medicare. So we do not sell anything. We do not endorse any specific companies or products. We are true consumer advocates regarding all aspects of Medicare and Medicare options. Every county and every state has access to a SHIP program, if nothing else through a statewide toll-free number. And I have listed both our local Colorado Springs number, which you can dial from any of the 9 counties that we serve, as well as our toll-free statewide number in Colorado. Just a quick note that you may receive as a result of attending this presentation, contact from the Administration for Community Living, which oversees Medicare programs and the SHIP program, regarding a result or a survey that asks about your satisfaction with the education and information that we are providing through this series. Your chances of being contacted are pretty slim, but because this is a nationwide survey, but we do ask that you do take the survey at the end of this presentation. It will be sent to you via email, usually sometime tonight or early tomorrow morning, because it really does affect and impact the funding that this program gets. Because we don't sell or endorse any insurance products, we are totally dependent on government funding. And so your opinion matters in that regards, and we appreciate your time and attention if you take that survey. So just a quick review of the topics we've covered already in the last 2 weeks. Week 1, we covered Medicare Part A and Part B, also known as Original Medicare, and we talked about eligibility, enrollment, benefits and costs. Last week, we covered Medicare supplements, also known as Medigap, and Medicare Advantage plans. And again, tonight, we're going to talk exclusively about Medicare Part D, the prescription drug benefit of Medicare. So what is Medicare Part D? So this is honestly the newest benefit of Medicare. It was established in 2006, and it provides coverage for over-the-counter, not over-the-counter, but prescription coverage that you go and get at the pharmacy. So it's only for outpatient prescription use. Prior to 2006, Medicare did not provide drug coverage, and that was something that you had to pay for out of your own pocket. We're going to talk about how the prescription drug plans that you have to choose from in your areas are all fashioned in the same way. They all will have formularies or list of drugs that they cover, but they all are all required to cover a specific range of medications, which we'll talk about. You may have to pay a monthly premium to have a Medicare drug benefit. You will have deductibles and you will have copays at the pharmacy. And there is potentially some financial assistance available for people who have limited or lower incomes and resources for lowered costs on Medicare drug coverage. And we'll talk about that as well. So, do you have to enroll in a Medicare Part D? Like all benefits of Medicare, it is optional. There's nothing in the laws that say you have to do any of this. So it is optional. To be eligible to enroll in a Medicare Part D, you must be enrolled in either Medicare Part A or Part B or both. So your eligibility for prescription drug coverage is going to start as soon as you're eligible and enrolled in any part of Medicare, whether it's A or B or both. But if you have other means of drug benefit, what's known as other creditable drug coverage, and creditable means whether or not the drug coverage you may have another option to use is considered as good or better than what Medicare offers through Medicare Part D, then you wouldn't necessarily need to worry about enrolling in a Medicare drug plan. For example, if you are covered through active employment and have employer group health benefits, you would not need to worry about Part D if you have a drug benefit through that. If you have a retiree health benefit that includes drug coverage, that drug coverage may be considered as good or better than what Medicare Part D has to offer. If you are a veteran and you access the VA pharmacy, that would be considered as good or better than what Medicare Part D offers, and you wouldn't be required or need to worry about enrolling in a Part D. If you have one of those other types of creditable coverage, and keep in mind that employers, even past employers, are required to mail you a letter every year that tells you whether or not any drug benefit that they offer is considered as good as or better than Medicare Part D. Even if you're not eligible for Medicare, you get that letter every year. So you would refer back to that letter to determine if your coverage is as good or better. But if you have one of those options and you choose not to enroll in Part D because of those options, keep in mind that if something happens down the road and you lose that creditable coverage for whatever reason, you would not be penalized for enrolling in a Part D at that time. Because you had creditable coverage, and that was the reason you didn't enroll in a Part D when you first became eligible, you would not be penalized and you would be given a special enrollment opportunity to enroll in a Part D based on losing that other creditable coverage. You may also want to look at costs and compare the costs with your current coverage to the costs that you would have with a Medicare Part D and see if those are comparable, if you save money with your current coverage or if you'd save more money with Part D. You might also want to consider what you're paying for your drug coverage through another option versus what you could pay for it through Medicare Part D. So a lot of things to take into consideration. If you don't have creditable coverage and you still choose not to enroll in a Part D plan, for example, I have a lot of people ask me, why would I want to pay for a drug plan if I don't take any drugs? I don't take any prescriptions, which is a legitimate question, but still not a good enough reason to not enroll in a Part D when you don't have other creditable coverage and not be penalized in the future if you choose to enroll in a Part D. So if you don't have drug coverage that's as good as or better than what Medicare offers, but you choose not to enroll in drug coverage when you first become eligible anyway, you would be allowed to enroll in Medicare Part D any year down the road during an annual enrollment period, but you may be penalized, meaning you'd have to pay a little bit more in premium because you didn't take advantage of your initial enrollment. And we will talk about that in a little more detail as we go. So enrollment periods for Part D are going to be the same enrollment periods that we've talked about already in the last couple of weeks. You've got the initial enrollment period, which coincides with your initial enrollment period into original Medicare A and B, which is that 7-month window that surrounds your first eligibility for Medicare, typically when you turn 65. And that's the 3 months prior to the month of your 65th birthday or month of eligibility, the month of, and up to 3 months after the month of your 65th birthday or initial eligibility. Then you have the annual election period, what we refer to simply as open enrollment every year. That's that October 15th through December 7th window. Any changes or enrollments you make during that time frame go into effect January 1st of the next year. And then, as I mentioned, there are always special enrollment opportunities depending on your situation that you may be able to enroll in a Part D plan outside of your initial or annual enrollment periods. I did mention that if you choose not to enroll in a Part D and you don't have other creditable coverage in place of Part D, and that's why you chose not to enroll, again, you would be allowed to enroll any year down the road during the annual open enrollment period without any restriction. But if you did not have other creditable coverage, you chose not to enroll anyways, when you do enroll in the future, you will be penalized. The penalty for Part D late enrollment works a little bit differently than it does for Medicare Part B. If you remember from week 1, the Part B late enrollment penalty is calculated at 10% per year for every year you delayed enrollment into Part B. And that's multiplied by the premium and then tacked on top of your monthly premium forever and ever. For Part D purposes, the penalty is calculated at 1% per month. For every month you are without Part D coverage or other creditable coverage after your initial enrollment period. That 1% per month is accumulated over time. So if you wait 1 year, it's 12%. If you wait 2 years, it's 24%, etc. When you do enroll, they'll take how many months you were without coverage. They'll add that up. They'll multiply it by that year's national average base monthly premium for Part D plans nationwide. For 2023, that national average base premium is $32.74. So if you were eligible 2 years ago, you didn't enroll 2 years ago, you didn't have other creditable coverage, you go to enroll this year, you're going to have a 24% penalty. They'll multiply that by $32.74. Whatever that comes out to will be tacked on top of the premium for whatever plan you choose to enroll in when you enroll. And that will be tacked on the premium every month forever. Keep in mind that if you accrue a penalty, a late enrollment penalty, that penalty lasts forever. It never goes away and it is tacked onto your premiums monthly. Now, if you qualify for financial assistance on Part D, even if you do enroll late, penalties are waived. As with Medicare Part B, Medicare Part D for drug benefits are also means tested, meaning if you have higher significant annual income as a single person or as a married couple, you could potentially pay a higher Medicare Part D premium. So an additional amount would be tacked on top of the premium of whatever plan you choose to enroll in. The income thresholds are the same as they are for Medicare Part B as in boy. So if you have an annual income as a single person of $97,000 or more, you could potentially be looking at higher Part B and D premiums. If your income is lower than that, then you're looking at paying just the premium for the plan you enroll in. And again, this is going to be calculated or determined based on the most complete, most recent IRS tax filing that Social Security can access, which is typically going to be old information. So if you haven't quite completed or closed out your income tax filings for 2022, the most recent complete filing they would be able to access would be from 2021. So it may be based on older information, and you may not have that kind of income in 2023. But keep in mind that Social Security does review those tax filings annually. So as your income changes through those searches, if you are initially imposed a higher premium based on a higher income, and that income changes when they review it for the next year, and you no longer have that higher income, they will no longer require that you pay that higher premium. So it will fluctuate as your income fluctuates. All right, any questions about any of that so far? Again, if you have a question, you can unmute and ask it, or you can type it into the chat. All right, I'm not hearing any questions. I'm not seeing any questions, so we will move on. So how does Part D work? So Medicare Part D and how that benefit works has been determined by Medicare. So Medicare has come up with a base template, which is the minimal amount of benefit any company can offer as a Part D plan. And that base template says that every year there will be an annual deductible. For 2023, the deductible for Part D is $505. What that means is if you have a plan that includes a deductible, once you've enrolled in that plan, the first time or the first couple of times you go to the pharmacy to get a prescription filled or a refill, you will have to pay full retail price for those medications until you spend out of your pocket up to $505. Once you've met that deductible or spent that amount out of pocket in retail cost, the next time you go to the pharmacy, you will hopefully have a much lower cost for your medications in the form of a copay. Once you've met your deductible, you go into what they call the initial coverage zone. The initial coverage zone is calculated at you paying approximately 25% of the cost of the retail drug or the retail cost of the drug, and your Part D plan pays the other 75% of the cost of that medication. So again, once your deductible is met, the most you would have to pay at the pharmacy would be 25% of the retail cost. And you're going to continue to pay that until you have spent or your total drugs expenditure, your total retail drug costs equal this year $4,660. And that would be adding the full retail cost, even though you're paying 25% or less. Once you've hit that $4,660, then you go to the next level of your coverage, which is called the coverage gap. It used to be known as the donut hole. In the coverage gap, you will pay 25% of the retail cost for your brand name and generic medications until your total drug cost reach a second level of tier, another $5,865 and change. Now you may be thinking to yourself, well, what's the difference between the initial coverage zone and the coverage gap if I'm paying 25% of retail in both areas? The difference is going to come in the fact that during the initial coverage zone, even though the minimal amount of coverage that these plans can offer to you is 25% of the retail cost of your medications, most every plan does better than that. So many Part D plans may offer zero copay generic drugs or $1 or $2 copay generic drugs instead of 25%. Or $20 brand name drugs or $30 copay brand name drugs instead of 25%. But once you hit that coverage gap level, then you actually will have to pay the 25% versus a lower optional copay. So most plans do better than 25% in that initial coverage zone. But once you pass that zone and into the coverage gap, they are required to charge you 25%. If you exceed that coverage gap zone, and again, this would be after another $5,865 and change in total drug costs, having totaled to get to the last coverage zone, $11,206 and change for the year, you hit catastrophic coverage. Catastrophic coverage begins after you have spent $7,400 in total costs out of your pocket. And that includes deductible and all costs spent in the initial and coverage gap zones. If you hit the catastrophic level of coverage before the end of a calendar year, in that level of coverage, your costs at the pharmacy do go down to 5% or a copay of $4.15 per generic medication or $10.35 brand name medication, whichever is less. And then the plan pays 15% of the balance, and Medicare actually pays the other 80%. Now, all of this would have to happen within a calendar year, and then come January 1st, it starts all over. And keep in mind that the deductible does tend to go up every year, as well as the amounts that you have to meet to get to the different levels of coverage. So again, this is the basic outline of a Medicare Part D plan that can be offered to anyone with Medicare, but most plans do tend to do better than this basic level. And that's why you might see a difference between the first and second coverage zones. Now, there has been some legislation at the federal level that is going to make changes to some of these levels in the near future over the next 2 or 3 years, so that in the next couple of years there will be a cap to your max out of pocket for Medicare costs. There will be enhanced benefits and cost savings for Part D benefits. And hopefully lower drug costs at the pharmacy for Part D benefits due to the government's ability to start negotiating with manufacturers. I'm not going to cover much of that at all tonight, simply because that legislation is not in effect at this time. And I don't like to get the cart ahead of the horse, and things could change between now and next year or now and 2 years. But there will be an opportunity later in the year, once legislation has been a little more solidified, to talk about these changes in the future. So for Medicare Part D plans, the companies that sell the Part D benefits, they are required to meet some Medicare regulations. The primary regulation is that all plans are required to cover at least 2 medications in every class of medication, medical class of medication out there. So what that means is if there are 20 different kinds of medication that treat high cholesterol out there, each plan is only required to cover 2 of those medications. They are allowed to cover more if they choose to, but as long as they cover at least 2 medications in every class of medication, they've met the Medicare requirements. There are 6 classes of medications that all plans are required to cover every drug, and that includes antidepressants, antipsychotics, anticonvulsants, antiretrovirals, immunosuppressants, and antineoplastics, which are cancer drugs. Any drug on the market and approved by the FDA, every plan has to cover under those 6 categories. But because they can choose what medications in each class of medication that they can offer for each individual plan, that's where formularies come in. So every plan out there can choose a different 2 medications to put on their formulary list. So it becomes very, very important to make sure that any plan that you consider covers your very specific medications, because they're all going to cover all the same classes of medications. But as we all know, there could be a lot of different brands of that medication out there. So you want to make sure that your specific medications are covered. It's also a requirement that Part D plans are only allowed to cover prescription medications that have been approved for use by the FDA and have been approved for use for their medically intended purpose. And what that means is that typically a Part D plan is not going to be allowed to cover a prescription for you if it's prescribed for an off-label purpose. So, for example, Viagra, if that's being prescribed for treatment of high blood pressure, because that was not its medically intended purpose when it was created, it wouldn't typically be covered by a Part D plan for high blood pressure, as an example. All plans are required to cover drugs and biologicals, including insulin, and the supplies for injecting insulin. And all plans are required to include both brand name and generic drugs on their formulary. Things that are not covered by Part D are going to be drugs that may have already been covered or would be covered under the other parts of Medicare, such as Medicare Part A or B. So any drugs that you receive while you're inpatient in the hospital would be covered under Part A. Any medications that would be covered under Part B, such as drugs that require a doctor to administer, like an injection, or say cancer treatments where you have to go for your infusions, those would be covered under Part B as an outpatient service. Only prescription drugs that you go to the doctor's office, the doctor hands you a prescription that he's written, you take that to the pharmacy for a refill. That is a Part D drug. Also does not cover anything that would be considered over the counter and does not require a prescription. Even if it requires a prescription, if a drug is prescribed specifically to treat anorexia or for fertility purposes or for cosmetic purposes only, it would not be covered by Part D. Even if it requires a prescription, if it's specifically and solely to treat cough and cold symptoms, such as Robitussin, which is a perfect example, it is not covered by Part D. And most vitamins and mineral supplements are not going to be covered because they don't require a prescription and are considered over the counter. There are some exceptions. If a vitamin or mineral has been prescribed to treat a specific disease or medical condition and requires a prescription, it should be covered. But for the most part, most vitamins and minerals would be not covered. All right, so any questions about any of that? Now, when it comes to Part D plans, they work very similarly to Advantage plans, meaning Medicare Part D has created the benefit. They made all the rules, they do all the policing, they tell the plans what's covered, what's not covered, and how they have to work. But then they have allowed private insurers to come and contract with them, with Medicare, to provide that coverage directly to you. So when you enroll in a Part D plan, you're actually enrolling in a private insurance plan with a private insurance company acting on Medicare's behalf. So I do see a couple of questions in the chat. Why does the government coerce elders through an increasing penalty to enroll for prescription coverage before we want it, if indeed you ever do? All drug costs are so bloated that the only way to provide RX coverage for those who want it or need it is essentially to force people who don't to subsidize it. So the thought process behind the penalties for any part of Medicare is that they want people to look at these benefits as you and think of them as you think of any other kind of insurance that you may purchase. For example, auto insurance required by law. You can't drive unless you have auto insurance. Whether you ever intend to use it or not, you always hope that you don't ever have to use it, but you still have to pay for it. You still have to have it in order to drive on the roads. Medicare wants you to look at Medicare benefits the same way. Whether you intend to use it or not, or need to use it or not, you are basically investing in a risk pool. So the risk that you may need to use medical benefits or need medical services in the future is human nature. It will all happen to us eventually. So they want us to be investing or paying into that program so that when we need benefits or need the medical services and use these benefits, we have paid into that system and we're getting that reimbursed by having our medical costs covered. So, even though Medicare benefits are optional, they don't want people to wait until you have a medical need or until you are suddenly prescribed a $1,500 a month prescription drug before you think about enrolling in these services and these benefits. Does that make sense? Hopefully. I mean, it's not a perfect system, but that's the thought process behind those penalties. You're welcome. And then the next question we have is, do all Part D plans have to have a deductible? And the answer is no. It is optional. Some Part D plans will pay that deductible for you. Some plans will pay part of the deductible for you. Some plans will pay none of the deductible for you. A lot of times that's going to be dependent on how much you're willing to pay in premium to have that plan as to whether or not you will have to pay that deductible or that plan will cover the deductible for you. And that's something that you'll be able to find out up front when we talk a little bit later about how to determine the best plan for you. But no, not all plans have to have deductible. Medicare applies it, but some plans can choose to pay that for you. Any other questions before we move on? All right. So, I mean, that's the basics of the Medicare drug benefit. Now, there are different ways you can get the Medicare Part D benefit. You can get it as part of a Medicare Advantage plan, like we talked about last week, where it becomes part of the all-in-one package that you enroll in when you enroll in an Advantage plan, and they take over your Medicare A and B and D all under one insurer. Or you can get it as a separate just drug benefit plan. And that's where you would look at more likely having to pay monthly premiums for that coverage. Now, I did mention there is financial assistance available for Part D benefits specifically. That financial assistance is called low-income subsidy, but more often referred to as extra help. This financial assistance is actually offered and provided through Social Security directly. So when you apply for this assistance, you actually apply to Social Security and do the application to them. Some populations who are already in a situation of limited or low income or may already be enrolled in some programs such as SSI or Medicare Savings will automatically be provided with the financial assistance, the extra help for Part D, based on their eligibility for those other programs. There are several levels as of this year of extra help based on income and resources. But that will change next year. Thankfully, that will be a lot more help to a lot more people. But as of today, there are different levels based on different levels of income and asset. To apply for financial assistance or the extra help, you can either go to the Social Security website, you can call the 1-800 number for Social Security, or you're welcome to give us a call and come and see us at your local SHIP office, and we do help people with those applications as well. When we help people with an application for the extra help, we actually do it through the Social Security website. It's literally one of the easiest applications you've ever done. Takes less than 10 minutes, doesn't require any verification, just self-attestation of income and resources, and they will take it from there. income and asset limits for the financial assistance for Part D are higher than the financial assistance programs for Medicare Part B. So for 2023, if you are a single person, the max monthly income right now is $1,843, and that's pre-deduction income, with an asset limit of $16,660, which includes a $1,500 burial disregard. If anybody wants more information about that assistance or would like to talk to one of us about an application, give us a call and we'll get you. We can even do it over the phone, and we'll just mail you a copy of the final application. It takes usually about 3 weeks to get a response from Social Security, and the extra help assistance goes into effect right away. If you qualify for the financial assistance, what it will do is it will reduce or eliminate a premium for Part D. It reduces or usually eliminates any deductible for a Part D benefit, and it reduces copays. Starting next year, they're going to eliminate the different levels of extra help, and everybody will get the same level of extra help based on, I believe, a higher limit, the higher end limit for income and assets. Again, that's still yet to be really finalized at this point, but we will have that information come October 15th for open enrollment. So it's going to expand the ability to assist many more people who may fall under those income criteria. And we're really looking forward to a very positive change to that benefit. If for some reason your income or resources put you over those limits for extra help, but your income is not enough to comfortably afford the cost of your medications, for example, if you're taking, $600 a month insulin medication or diabetic medication, even with a Part D plan, that can become problematic as far as how much you pay at the pharmacy. But there could still be some assistance through patient assistance programs directly from the manufacturers. Patient assistance programs, because these are financial assistance programs offered directly through the drug makers, they tend to have much more generous financial limit criteria. And if you are approved through patient assistance for a particular drug, then typically you're not going to have to pay anything for that drug for the remainder of the year. So it's either much, much lower copays or no copays at all, no cost to you. Because these are offered by the individual drug makers, each drug maker will have its own criteria for financial assistance. But again, those income and asset limits are going to be much more generous. To find more information on whether or not any of the medications you take would fall under a patient assistance program, I've listed several websites that you can go to get that information. I tend to like RX Assist the best because it's pretty straightforward and you can usually download an application if you think you qualify. Typically, patient assistance programs is only going to be for brand name drugs. So for example, if you see a commercial on TV for a drug right now, that means that drug is really, really expensive, but it likely has patient assistance programs with the manufacturer. So, any questions about any of that? All right. So things to take into consideration when you are looking at a Part D drug benefit for yourself are premium costs, whether or not that a plan covers your specific medications, your copays, deductibles, and coinsurances. So lots of things to take into consideration. And there are not very many ways to be able to find that information. Your first option would be to get on the phone and call each and every Part D plan provider and ask them specifically if they cover your medications, what their copays are, what the premium is. Do all the math yourself to see if it's going to be cost effective, which is probably not the best way to go about it. You could always contact an agent or a broker that sells Part D plans and let them do the legwork for you. The downside to that is they may limit the number of plans that they will review for you. So you're not seeing the whole picture. You're only seeing the plans that they want to offer. Or your best option is to go to the Medicare.gov website and use their search engine, which they refer to as the Plan Finder, which allows you to enter all of your specific medications down to quantities and dosages. It allows you to enter up to 5 different pharmacies that you might shop at. And it will take that information, compare it to all 27 Part D plans available this year, not including the plans and Advantage plans, just 27 standalone plans available. It'll compare that information to all those plans, and the end result is it will list those plans in order. From at the top of the list will be the plan that would be the most cost effective for your specific medications, to the bottom of the list that would be the least cost effective for your specific medications. It does all the work for you, and it is literally the best tool in the toolbox to try and determine Part D coverage for yourself. Now, during open enrollment this coming October and every October 15th through December 7th, we spend every day helping people with that process. So we have people who've been coming to us for years and years. They come in, we review their coverage by entering their drugs into that system, and it will compare the plan that they have now and what it would cost next year to any of the other options available next year. And they can look to see if keeping their plan is going to be their best choice as far as cost, or switching to a different plan would be more cost effective. And if they choose to switch, we can help them with the enrollment. It's really a quick and easy process once all the medications are entered, and we're always happy to help people with that. Time. So we do have a few minutes. I am going to go online real quick, if you guys are okay with that, and show you the Medicare website in case you have not been there. If I can find it. So give me just a sec. So let me share my screen. All right, so hopefully everybody is seeing the Medicare homepage, medicare.gov. Very simple, very easy to navigate. Simply says, welcome to Medicare, medicare.gov. For looking at your options for Medicare Part D, what you're going to want to do is go down to the Find Health and Drug Plans tab and click on that. As with Social Security does encourage you to create a personalized My Social Security account that's very secure, but it's not required. Medicare also encourages you to create your own personalized My Medicare account, but it is not required, and you don't have to have an account to do anything that you are able to do in the Medicare website. If you have an account, you can simply log into that account. But if you don't have an account and don't choose to create one, all you have to do is have a zip code. So we're going to put in a zip code. We continue. It's going to ask us what kind of plan we want to look for. If we pick Medicare Part D, find plans, it's going to ask us, do we qualify for any financial assistance for drug coverage? I'm going to say no, I don't get any help. I'm going to hit next. Do I want to compare drug costs with these plans? I'm going to say yes. We're going to put in a couple of drugs just to give you an idea of what you're looking at. It says, great, let's put in some drugs and do some comparisons. At this point, it gives you the ability to type in your specific medications. And when I say specific, you have to be very, very specific. If you take a generic drug, you want to type in the generic name. But if you're not sure what the generic name is, so let's use the brand name Lipitor. As I type, it starts to autofill the name of drugs. Lipitor comes up at the top of the list. I'm going to click on that. Lipitor is available as a generic. So I take Lipitor, but I take the generic, not the brand name. So I type in Lipitor, I'm going to add that drug. It's going to tell me this drug is available as a generic. Do I want to add the generic instead of the brand name? Absolutely, I'm going to add the generic. Then it's going to ask me, what dosage do I take? If you hit the drop-down box, it's going to give you a list of all the available dosages that drug is available in. It will default to the most commonly prescribed dosage, but if that's not what you take, you can change it to whatever's appropriate on that list. I'm going to let it default to 40 milligram tablet, 1 tablet per day every month. But you would also be able to choose every 2 months, 3 months, 6 months, or 12 months. So if you take one medication only once every couple of months, or if you have like a cream or something that you only have to refill once every 3 months because you only use it as needed, it gives you a little flexibility on quantities. But I'm going to let this sit at 1 tab a month, 1 tab per day per month, and I'm going to add it to my list. So here's the first drug on my list. It's going to ask me, do I want to add another drug, or if I'm done adding drugs? I'm going to add one more drug. I'm going to add a brand name. Let's go with Eliquis. That's a pretty common drug these days, not cheap. So again, I start typing the word Eliquis. It starts auto-filling it in with all of the options that might match. I'm going to click on Eliquis. I'm going to add that drug. Again, I get the drop down for dosages. I'm going to let it default. This defaults to 2 tablets per day per 30 days. I'm going to change it to 30. I'm going to add that to my list. So I've got 2 drugs. I've got a generic. I've got a brand name. I'm going to say I'm done adding drugs, but you can literally add 25 or more drugs to this list. Hopefully nobody takes that many, but it does accept a lot of drugs on that list. So I'm done. Now I get to pick a pharmacy or multiple pharmacies. Has a map, and it's going to base the pharmacies that it lists on the left-hand side here on a radius of 1 mile from the center of the zip code that I initially put into the search, which was 80907. So this map is going to show a mile radius from the center of 80907, and it's going to list any pharmacies located within that radius. You can choose up to 5 pharmacies, but you don't have to. You can choose up to 5. You can pick 1. I always encourage people to choose at least 2 for comparison purposes. It also gives you a mail order option if you get your medications through the mail. So I'm going to go with mail order, Walgreens, and the medicine shop. If you don't see the pharmacy you use on here, you can make that radius distance greater. If I expand it to 5 miles and hit apply, I'm going to get a much larger list of pharmacies available within that radius. So now I've got King Supers and up to 8 pages of pharmacies now within a 5-mile radius. So I'm going to pick those 3 options, Walgreens, King Supers, and mail order. Down at the bottom here, it's going to list them, and I'm going to hit done. And now we're going to get the end result. This is going to list all Part D plans, and I was wrong. There's only 23 plans to choose from this year. All standalone Part D plans, and they're going to be listed in order of the plans that overall are going to save me the most money at the top of the list or cost me the most money at the bottom of the list. When I look at these plans, what they're basing that listing order as is total drug and premium costs. How they're coming up with that number is they're taking the monthly premium for that plan and adding it for the next 6 months or 5 months left in the year. They're going to take the deductible if it has one. They're going to take your copays at the pharmacy for the next 4 or 5 months. They're going to add all of that together. That comes to the total drug and premium costs for the rest of this year. And we're looking at retail pharmacy, $473 for those 2 medications for the rest of this year. But this plan has a $71.30 monthly premium. If I go down to the second plan on the list, it has a $69 plus change premium. Total estimated cost at the retail pharmacy, $474 and change, so a couple of dollars more. We go to SilverScript at $83. Wow, Anthem at $90. I should have chose two different drugs. And then at number 5, we have WellCare Value Script, $3.50 a month. This is the lowest premium plan available this year. $3.50 a month has a total drug cost for the rest of this year for those two medications at $651 at the retail pharmacy. It does have a $505 deductible. So this is how it's going to sort those plans. And then you can go into each plan and look at your individual drug costs. So if I click on the blue bar of plan details, again, it's going to show me just information for this particular plan, WellCare Value Plus. Monthly premium of $71.30. Your copays at the pharmacy are only going to total $188 for the rest of this year. The rest of that is going to be your premium. So $71.30. It has no deductible. So for that kind of premium, you're not likely going to have to pay the deductible. The plan will pay it for you. It's going to, as we scroll down this page, tell me that Walgreens and King Soopers are both preferred in-network pharmacies. And of course, their amount order is going to be preferred in-network. And then it's going to show me what I'm going to pay for those medications at each pharmacy for the rest of the year. So for generic Lipitor, this plan has 0 copay at any of those pharmacy options. And for Eliquis, I'm going to pay total for the rest of this year in monthly copays, a total of $188 at the local pharmacies. It would actually cost me more if I did it through mail order. And that's how they're coming up with the total drug costs. Again, it's going to reiterate the costs for the whole year in premiums, deductibles, and copays. Then it breaks it down even more. And it's going to show me what I'm going to pay in copays every month for those two drugs. Again, we've already established that the generic Lipitor has no copay. I'm going to pay nothing for that with this plan. But each month for the Eliquis, I'm going to pay $47 copay. So they're adding that $47 for the next 4 months. They're adding that $71 premium for the next 4 months. Those two factors, because there's no deductible, are being added together for the rest of the year. That's how they're coming up with that $474 total estimate cost for the rest of this calendar year. And we can even break it down even more by individual pharmacy. This is what generic Lipitor would cost retail, no copay. If you hit the coverage gap in your benefits with this plan, it would go up to 50 cents in the coverage gap. The Eliquis retails for $325, but I'm only going to pay a $47 copay until I hit the coverage gap. Then that goes up to $81. If I were to hit catastrophic coverage, the cost goes down, and it will show me that for each pharmacy option. So it gives you tons and tons of information, but for most of us, the bottom line is how much is this going to cost me for the year? And that's why the way they sort it as the end result is going to be the most effective way to pick a plan, because the plans are typically going to be the plans that come at the top that cover all your medications. When you come over here, it's going to tell you, or when you look at the plan details, it's going to tell you whether or not all your drugs are covered. If it doesn't cover one of the drugs you put on that list, it will tell you that. When you get down to the more specific details, if it doesn't cover one of your drugs, it will say right next to the drug, not covered. Or it may have a note, a little number in parentheses that correlates to a note at the bottom of the page that says this is not a Medicare covered drug, which means no plan will cover it. So the amount of information you get with this search engine is incredible. And again, we are happy to help people through this process during open enrollment, but we're happy to walk you through this website at any time for people who are becoming eligible or need to get that information sooner because you're going to be in Medicare sooner. At any time, we're happy to help with that process. Any questions about any of that? We're about to wrap it up. I only got a few more slides left.
I do have a question. So if you're not
Yes.
really taking much of anything as medication now, Does it make sense to choose the cheapest plan now and just wait and see what is added later? You're able to change that plan yearly?
Yes, with Part D plans, because you have the annual open enrollment period, that October 15th through December 7th window, you can look at your plan options every single year based on your specific needs that year. Whatever your, I mean, if you have a prescription added midway through a year or 2 or 3 of them, you're obviously probably not going to keep the same plan because it may not cover those drugs. So every year, because your situation may change, you have the opportunity to look at whatever else is available for the next year to see if there's something that would save you the most money, whether by switching to a different plan or keeping the same one, but it's without restriction. So if you don't take any medications, clearly I usually encourage you to go with that $3.50 plan or whatever plan has the lowest premium from year to year, so that you're spending the least amount of money but still have coverage if something happens.
Great, thank you.
And you avoid penalties by doing it that way. Absolutely. But as you can see, the plans that come up are totally dependent on the prescriptions that you need covered. So if you have a lot of brand name prescriptions, you're going to get a plan that's going to probably be a little more expensive. If you take a lot of generic prescriptions, even if you take 5 or 6 of them, if they're all tier 1 generics, the lowest cost generics, you may have that $3.50 plan come up because you'll have 0 copay on all of those drugs. So it really is, you have to be very, very specific about the drugs that you need a plan to cover. And the plans don't care what drugs you take. They do not care. They tell Medicare what drugs they're going to cover every year by September. And then it's just a matter of you finding the plan that covers what you need it to cover. They're never going to look at specifically what you take and try and determine what you have to pay based on what you take and how much it's costing them. That's irrelevant. Medicare tells them, you tell us what you're going to cover, and then you simply choose a plan that covers what you need to cover. I do have a question in the chat. Does Medicare run the mail order drug service? No. Each one of the individual plans offers their own mail order system. So, AARP has their own mail order pharmacy and WellCare has their own mail order pharmacy. They all have their own pharmacy. And as you saw, sometimes doing mail order can save money, but sometimes it doesn't. So that example we just showed, WellCare's mail order total for the year was much higher than the retail pharmacy. Mail order in any scenario with any company is usually going to give you much better savings on generic drugs than it will ever give you on brand name drugs. So if you take nothing but generics, mail order could save you a lot of money. You throw one brand name drug in there and it really becomes not worth your effort to do mail order, but you could do both. You're not limited to just using the pharmacy or just using mail order. If you want to get all your generic drugs through the mail order, but it's cheaper to get your brand name drug at the pharmacy, you can do it that way as well. You're not limited to how you use that system. And yes, the total drug cost that they use to come up with that total for the year does include deductibles if the plan has one. Any other questions? Okay, well, let's wrap this up and get you out of here. So I did mention in week 1 that Medicare does allow you the option of creating a personalized account within that system, within that website. The advantages of having a personalized account is that it saves your list of medications that you type in for open enrollment or when you first enroll. It saves that in the account so that you don't have to type it in every year during open enrollment if you're looking at your options. It also has going to have a history of all plans that you've ever enrolled in. It's going to give you the ability to print out a duplicate Medicare card if you need to. It has an electronic health records option if you wanted to use something like that between you and your doctor. So there's a lot of functions that you can use having a personalized account. Again, it's not required, but it is encouraged. They are secure, and Medicare.gov accounts are really easy to set up. but you do have to have a Medicare number to do so. So we already went through the plan finder. So other resources obviously are always going to be Medicare directly. So the Medicare and You handbook, you can always go to the Medicare.gov website. You can call Medicare 24 hours a day, 7 days a week, 365 days a year via their toll-free number. But keep in mind, they do not have a brick and mortar location. You cannot go see Medicare. You can either go to their website and chat with them, or you can call them on the phone. Or you can call the next best thing and talk to your local SHIP office. And then in Colorado, we are very fortunate that our Division of Insurance, which runs this program at a state level, provides us with some additional resources for open enrollment, which gives you like a kind of a mini newspaper type listing of all the plans available in Colorado with kind of a side-by-side comparison. If for some reason you didn't have access to, say, the Medicare website or something, but they do that for us every year. But again, the plan finder is always going to be your most reliable resource for that search. And as always, I have to plug our sister program, Senior Medicare Patrol, or SMP, that is always looking for volunteers who are interested in fighting Medicare fraud and abuse by educating the community on how to protect, detect, and report such fraud and abuse or potential fraud and abuse by doing educational presentations. Please give me a call if you want more information or might have interest. And that is it. That is Part D. If you have any questions or you think of any questions after this presentation is over, you're always welcome to email me. I'm happy to chat with you via email. It is the best way to reach me to get a quick response. You're welcome to call us at our office. I have a total of 5 full-time counselors and 3 part-time volunteers who are all certified and trained and would be able to answer your questions. If for some reason they couldn't, they will always come to me and I will help them answer your questions. Again, our statewide toll-free number, if you call that number from anywhere in the state of Colorado, it will route you to the SHIP office closest to where you're calling from. But this particular office in Colorado Springs, we cover a total of 9 counties as listed on the slide. And that is it. Any questions before I let you go? All right. Well, as always, I thank you for joining us tonight. I appreciate your attendance in our Medicare presentations. Hopefully you find it useful and necessary information. Please feel free to reach out to us if you have any questions or would like to schedule an appointment to sit down and meet with a counselor one-on-one. We're always happy to do that. We are taking in-person appointments, but we can also do over the phone or online via Teams, like an online video chat. And you are always welcome to contact us with any questions at any time. And hopefully you will join me for our last presentation next week, our part 4 of our 4-part series, where we will talk about Medicare and other types of insurance options, such as retiree or employer plans, military coverage, that kind of stuff. That'll be a short and sweet presentation, but it could have some useful information as well. All right. Well, again, thank you so much for joining us. I hope you guys have a good evening and a good rest of your week, and I will hope to see you next week.